Good afternoon. I came in the beginning to welcome. I came to give the bye-bye to you. Um, we have heard so much about that, and then sarcopenia and so many things. And then I think we need to address this optimizing muscle nutrition. Um, how can it be done? Can be done with a high protein in the nutrition, along with if you can do it with pre and probiotics, then this is a possibility that can happen. So what we can do is that let us look into what is happening to the protein in our commonly in India. This is essential for various body functions. All of us know that, and often lacking and overlooked in Indian diet. That's the most important thing. It's not, overlooked actually. And if you look into that survey that has been done, you could see that 73% of Indians are protein deficient. 90% of the people are unaware that protein is important component. And also, a good majority, about 85% of the people feel that protein consumption may increase the body weight. So these are the misconceptions that we've been having. Now, if you have a low protein intake, what are the problems that you have is that you develop weakness and increased hunger and muscle atrophy, increased susceptibility for infections, brittle hair and nails, mood and cognitive impairments can happen, and increased risk of fractures. Why it is happening, increased risk of fractures? Because when you have high protein, calcium absorption also will improve. So that's the reason bone became a resorption, and then you can get into fractures. Now, adequate protein intake, what is the recommendation that we have given is that usually about 0.8 grams per kg per body weight. For approximately somebody who is about 65 kilos in weight, you need to take 54 grams you have to take every day. But this is for the general population. But in people who are in older individuals, we need to give at least 1 to 1.5 grams per kg body weight. That is about 20 to 25 to 30 grams with every meal that you need to give. So I think when you come to such a situation, we need to increase. Now, all of us know that now we are in the era of using so many drugs where weight reduction is becoming a main integral part of what we have to do, that like SGLT inhibitors, and you can see the GLP-1 receptor analogs. But there is definitely sarcopenia. In these situations as well, I think we need to give stress on importance of giving the extra protein. So if you can give about 1 to 1.5 grams protein, that will be there. And apart from that, there is one more reason why we need to look into that, especially older population, why we need to give more protein, is that there is a very simple thing that I'll talk about after 2 minutes. Now, before going into that, I think let us look into the why is it important to have protein, because it functions of the muscle protein is that the muscle protein serves as a primary repository for amino acids and provides free amino acids for following functions. One includes that it's an integral part, reincorporation of muscle protein, energy production through oxidation, gluconeogenesis when the glycogen is over and lipid stores are all over, only then the protein will break down. It doesn't happen. It doesn't happen immediately. First is glycogen. When you're starving, glycogen exhausts, glycogen is converted to glucose by glycogenolysis. And then if it is exhausted, then free fatty acids will come into play for energy production, for hepatic glucose output. And then only when that is also exhausted, only the protein will go out. And most important thing is that they are very, very important in synthesis of immune components, plasma proteins, hormones and enzymes. You can see that everywhere it is needed actually. So, and other thing is that there are certain acts like, that when you don't take essential, the amino acid intake from diet is essential for muscle repair and growth, highlighting the significance of dietary protein. And by taking protein and doing exercise, this is what we are talking about. Any weight reduction program, we say that give protein and also do exercise, especially the resistance exercise, so that it stimulates muscle growth by triggering repair and strengthening of muscle fibers. This is very, very important. Integrity of the muscle mass is a very, very important thing. So it's not just giving high protein. We need to also make them exercise so that it is better utilized. Now this is what we're talking about. In the life course, if you can see that, it is not, the metabolism is such that, that the maximum muscle mass happens around 30 to 35 years of age. And after 30 years of age till about 50 years, every decade you may lose about 3% of your muscle. That's usual. And then after 50, with every year, you may lose about 3 to 5% of muscle mass. So that is the reason, with the age, I think instead of giving a regular diet, in order to, especially if you can see that our elderly people at home, you can see that they become very thin. You can see that thighs are thinner, and then shoulders becomes more lax, and then you can see that buttocks also will come down the muscle. This is what usually happens. So I think we need to recognize that, and after 50, I think you should concentrate more in giving that extra protein that is very, very important. Now, there is one more part of it for improving the muscle function is the gut wellness actually. If you can see that gut wellness and it is over nutrient absorption is that the maintaining a healthy gut can significantly reduce occurrence of severity of functional gastrointestinal disorders, and also it can see that it also can reduce the IBS, that is irritable bowel syndrome. Importance of healthy gut includes that effective digestion and absorption, improving gut motility, stable intestinal microbiota, effective immune status, and absence of GI illness are happening. So I think it needs a given, you have to give a combination. Now, gut microbiota is not just microbiota, it has got effect on the metabolism and synthesis of vitamins and amino acids. Look at this, gut microbiota will also help in amino acid synthesis. That is integral part of the muscle. And now it can also improve the immune system. And then there is one thing what is called as gut-muscle axis. You can see that gut-muscle axis is the one which says that improves protein digestibility, gut permeability, and short-chain fatty acid production. So this is very important. You know, when you have a good microbiota, the digestibility of the protein and absorption also will improve. And reduces the translocation of pro-inflammatory molecules, enhancing insulin sensitivity in the muscle as well. So it's not just a simple thing, but it has got a lot of importance. Now, how about prebiotics? Now, prebiotics is nothing but, we should understand that there's a difference between prebiotic and probiotic. Prebiotics are defined as non-digestible oligosaccharides. They are not microbiota, but they undergo transformation by beneficial colonic microorganisms such as probiotics. So probiotic is different. Prebiotic will enhance the probiotic activity to potentially give other health benefits to the host. So prebiotics nourish other beneficial bacteria by supporting their growth and reproduction. So a good microbiota which is there to improve the growth, you need prebiotic as well, and it is not a microbiota. Now look at the probiotics. Similar, you can see that probiotics are basically microorganisms, and prebiotic is not a microorganism. And when administered in adequate amounts, a health benefit to the host happens, because the most beneficial ones are lactobacillus and bifidobacterium. All of us, you know about that. And then they have got the same like prebiotic. You can see that its immunomodulation can happen, normalizing gut microbiota can happen, and metabolic effects include vitamin synthesis, lowering cholesterol, and improved lactose tolerance itself actually. So you can see that the prebiotics and probiotics in protein absorption, this is where you need it. Just giving a probiotic, probably we can also promote taking more in pre-probiotics, whether it is taken as a nutrition supplement or through natural way. We need to think about that, so that it regulates intestinal microflora, induce host digestive protease and peptidase activity, and improves small peptides and amino acid absorption. Again, you can see that, and reduces the harmful protein fermentation. So you can see that whatever protein you are taking is better utilized. That's what is the most important. This is a pictorial form of what we can say that healthy gut and protein absorption and the gut muscle axis. So you can see that there is, for muscle, there is a gut axis. So this is what we would like to tell about that. Now, there is one or a unique probiotic which has been found. which is called as Bacillus coagulans, and which is also called a unique IS2. It is called as, it's basically a probiotic, it's a microorganism. And if you look into the properties of the Bacillus coagulans, you can see that it has got a resilient nature and thrives in both aerobic and anaerobic atmosphere. And digestion, it produces various digestive enzymes, aiding in efficient nutrient breakdown and absorption. It has got antimicrobial properties. And of course, the most important thing is that it is capable of producing vitamins and contributes to overall nutrition balance. So probiotic potential includes, it has promising probiotic potential offering benefits for gastrointestinal health. Now, what is evidence that we have for this is that this is one study, a study done, and then they have given, but they've taken about 138 people, and then what they have found is that by using this particular unique IS2 probiotic, you can see that supplementation with this IS2 with whey protein significantly increased the absorption of the proteins, that is amino acid absorption is improved, and improved the muscle power in the lower body and suggestive of positive effect. So this is a probiotic protein utilization and exercise performance in resistance trained males is being found, and then it is a very important thing. And then one more study that has been done. It's a small study which what has been found regarding constipation, maybe probiotics. This has been found to improve the constipation itself. Actually, got a better. I think most of our older patient comments, the only complaint they say is the constipation. Most of us, even in the hospital when I go for rounds, I'm the earliest person go to the hospital for rounds. They always complain about these things. Now, I think there is one more. This is a prebiotic, actually, oligosaccharide, which is a prebiotic, oligosaccharides. And then you can see that why prebiotics are very important. It has got a prebiotic effect, include that short chain fatty acid production and growth of beneficial bacteria, and then relief from constipation, and facilitates mineral absorption, especially the calcium and other things. And then modulation of immune system so that infection rates also should come down. So it is got very. Is there any clinical evidence to say for this about the prebiotic that we are talking about? And then yes, it is there positively influence gut bacteria by promoting the growth of bifidobacteria and reducing the TAR-based concentration and effects lasting even after FOS intake period. That means indicating that it's got a long-lasting benefit on the gut microbiota. And another one which has shown that is that on constipation, like probiotics, even prebiotics are very effective in relieving the constipation. So there are, apart from these things, there are other benefits as well. So friends, let me conclude to say that muscle loss begins as early as 30 and can accelerate significantly due to lifestyle factors like physical inactivity, malnutrition, and an unbalanced diet. And then also the musculoskeletal integrity is maintained by an interplay between proteins, calcium, vitamin D, while the primary role of proteins is to maintain the muscle mass. Calcium is vital for bone structure and muscle function, and vitamin D enhances calcium absorption and bone health, and all should be integrated in whatever we are trying to improve on the quality of life of a person. So maintaining a healthy gut microbiota is a very, very essential thing, as we explained. High protein supplementation is not just enough, that we need to have, along with pre-probiotics, added with a physical activity, then the muscle integrity and muscle strength also is very important. So thank you for your patient hearing.